So, and good morning, Excellencies, ladies and gentlemen. I am Pan Suchita, your MC for this morning. I would like to thank you for participating in today's event. We would like to warmly welcome you to the first session of our webinar series. This session is an introduction to and launch of the project on the impact of COVID-19 on inclusive development and governance, rapid and post-pandemic assessment in CLMV. The COVID-19 pandemic is having unprecedented social and political, economic effects on economies of developed and developing countries. The impact could also be disproportionately distributed across countries. No exception for the CLMV, having small and low-income countries face severe consequences, given their relatively weak health system, limited fiscal and monetary policy options, and a relatively strong reliance on external trade. Thus, understanding the impacts of and recovery from the pandemic remains crucial, and that is the main objective of this project. So this webinar is a part of the regional project, which aims to introduce and launch a 3-year regional project investing short and long-term effects of the COVID-19 on inclusive development and governance in CLMV. Secondly, it informs and engages relevant stakeholders in the research process. And lastly, it gathers additional inputs for the project design. So I would like to walk you through the agenda of this morning. We will have 2 opening remarks by Dr. Pek Sukhem, Executive Director of CDOI, and Dr. Anindya Chatterjee, Regional Director of IDLC Asia. And this will be followed by presentations from 2 distinguished speakers, Dr. Jayan Menon, Senior Visiting Fellow at ISAS, and Professor Kyoko Kusakabe, Asian Institute of Technology. And we conclude our webinar with a panel discussion comprising of directors of partner institutes under the project. And Ms. Jillian Dowie, Senior Program Officer at IDLC, will be moderating that discussion. So please note that there will be Q&A session after presentation and panel discussion. So participants can drop their questions into the chat box or Q&A box in the Zoom. For participants who are streaming live on Facebook, please also drop the questions in the comment section. So without further ado, I would like to invite Dr. Pek Sukhem, Executive Director of CDOI, to provide the opening remarks. Doctor, please.
Thank you, Suchita. I would like to warmly welcome all participants. I checked that at least on the Zoom, about 70 of us are online now, maybe more on the Facebook. It's a great privilege for me to welcome Dr. Anindya Chatterjee, Director of the IDRC Asia. I hope he's going to talk directly from New Delhi, India. I also would like to welcome Jillian Dowie for her great effort in making this thing line up together with our project team. She's calling from Canada. And I also would like to welcome Dr. Jayan Menon and Professor Kusakabe. I hope that they are calling from Singapore and AIT Bangkok, respectively. And we also have our great partners from Laos, Faculty of Economics and Business, National University of Laos. We also have our great friend, Dr. Xiao Wu, Director of the Center for Economic and Social Development, and also Dr. Nguyen Thang, Director of the Center of Analysis and Forecasting. So we almost like we are talking all over the world. And the topic and the project launch is very relevant for the world, as now we are entering the second year of this pandemic after it happening quietly somewhere in Asia, and then later on declared by the WHO as the global pandemic. And it's now spreading in over 197 countries. And today, statistics show that nearly 70 million people are positively tested for COVID-19. And we also have higher number of casualties, and the numbers are running up very quickly. And in Asia, like Japan and Korea are now preparing for third wave of COVID-19. And Cambodia is not exceptional. Now we are facing the first community infection in the country. And we all have to take a good care of ourselves and also limit on our ability to meet you face to face. But thanks to this technology, we can meet and talk and keep doing our good works. And we also glad to hear that at least the light in the tunnels with the vaccine being approved for using in UK and also in Canada. Hopefully they will be available to other poorer countries. And that also leads us to the question, to the topic of this project, rapid and post-pandemic assessment in the Mekong sub-region countries. And here we are focusing on Laos, Vietnam, Cambodia. And we also want to focus on the issues, how that will have impact on inclusive development and also democratic governance in these developing countries. So this topic is highly relevant and timely, and I look forward to the discussion, the presentation from our speakers and also from our panelists. And this is just a start of many more engagement and interaction, because one of the main topic for discussion is to how we are going to make this study highly participatory, highly relevant to the government and decision maker, so that make sure that the poor and vulnerable people will not be left behind, and the inclusive development can still be achieved during pandemic and also after or post-pandemic recovery. So with that, I would like to join later on Dr. Anindya Chatteri in opening this session one. And as I said earlier, it's just the start, and we hope to have more and more of this kind of interaction in the future. Thank you very much.
Thank you so much for your insightful opening remarks, Dr. Paisukhem. Next, I would like to invite Dr. Anindya Chatterjee, Regional Director of IDOC Asia, to provide the opening remarks. Doctor, please.
Morning, thank you. Very outset, thank you, Dr. Paisukhem and colleagues at CDRI, particularly Netra and Bartana, and rest of the CDRI team for organizing this event. And I want to thank and welcome all the speakers and partners from the region, including other consortia partners, the Center for Economic Social Development in Myanmar, the Center for Analysis and Forecasting at the Vietnam Academy of Social Sciences, the Faculty of Business and Management at the National University of Laos. We are very pleased to launch this project as part of our wider initiative designed to respond to COVID in low and middle income countries around the world, particularly to capture the socioeconomic consequences and that will generate evidence and advice to a range of stakeholders on the response needs. It became quite clear, earlier in the year, in March, that this pandemic is going to be life-changing for us. And our Asia's epidemic is still growing, is diverse, and dynamic. With its origin in a corner of Asia, this has now reached all over the world and killed 1.5 million people within a year. But there is also some good story. Silver lining is that we are renewing focus on building health systems again, and the first vaccine is already being tested out, although we all hope that there will be equity in vaccine production, access, and vaccination. So coming back to economic impact of COVID, of course, it is severe in Asia. The region is now expected, I was looking at ADB website, to contract by about 0.7% in 2020, with all the border restrictions, quarantines, lockdown orders. And this is like a regional recession in many decades. About 15% of the regional GDP is being announced in terms of monetary packages, divided between income support and measures to shore up liquidity and credit. Most macroeconomists I've spoken to view the situation as pretty bad, and that recovery will be slow and painful. Plus, we are not over the curve yet. A prolonged global pandemic slowdown will also severely harm economies, and particularly those who depend on tourism, commodity exports, and other forms of external demand. Certain sectors of the economy we already know, such as the informal sector, are severely hit. So, like other organizations, we have also shifted our plans for this year to respond quickly to this crisis by seeking data, evidence. There is urgent need for reliable, contextual, local data and evidence to inform appropriate responses. So this initiative is part of that effort. And it is called CORE Initiative, COVID-19 Responses for Equity. It consists of 21 projects across Asia, Africa, and Latin America. It focuses on economic policies to mitigate impact and look at recovery pathways, efforts to protect informal businesses, small producers, and women workers. In all these projects, we recognize that women have been disproportionately impacted. Women's care responsibilities increased dramatically when schools closed and regular health care was disrupted. Many sectors that employ large numbers of women have suffered, with a slow recovery projected, including domestic work and garment sector, and the shutting of the entire tourism industry. Putting women and vulnerable people at the center of recovery pathways can help ensure that COVID-19 does not set back progress on gender equality, particularly in this region. The pandemic also risks setting back progress on achieving the SDGs, which was an ambitious goal even before the crisis. So going back to our own work, we have also made investment in strengthening disrupted food systems, understanding the role of artificial intelligence and data in effective responses, and collaborated with Canadian institutions in supporting research on strengthening public health response. At the same time, we have been, redeveloping our next 10-year strategy to be fit now for for purposes in a post-pandemic world, where we have, of course, quite serious development problems. Climate change is one of them. And we've seen severity and frequency of natural disasters, failure of livelihoods with population mobility due to climate change, and so on. Plus, the COVID pandemic clearly shows that the relationship of humans with nature is broken. And this we must consider in our research agendas as we go forward. We need to ensure that research now in response to the pandemic plays a much bigger role in preparing all of us, governments, private sector, workers, civil society, for future problems and help us to achieve our dual goals of inclusion and sustainability. We are looking forward to hearing from Greater Mekong Sub-Region today, consortium today, and their plan for work on pandemic response and recovery in 4 countries, Myanmar, Cambodia, Laos, Vietnam. Building research consortium, research collaboration regionally, working together regionally is one of our main objectives. And some of you have been our partners for many years, and we deeply appreciate that. And this kind of collaboration, I think, is wonderful. So again, we are proud to support this initiative, proud to see regional collaboration on pandemic recovery. And thank you once again who are joining us online. And thanks to CDRI colleagues, Dr. Sokem and other colleagues once again. Thank you very much.
Thank you so much for your warm opening remarks, Dr. Anindya Chatterjee. Our first presentation is on post-pandemic economic recovery in ASEAN, prospects and challenges. Dr. Jayan Menon, Senior Visiting Fellow at ISES, is keen to share his knowledge on that topic with us. And after the presentation, there will be Q&A session as well. So please be reminded that the participants can drop the questions in chat box or Q&A box or the comment section on Facebook Live. Dr. J, please.
Thank you and good morning, everyone. It's a great pleasure for me to be here today. And let me echo the sentiments of our Dr. Sokempek and Dr. Chatterjee in thanking CDRI for their excellent work in organizing this event today, and also to IDRC for supporting this very important project. I'm delighted to be speaking to you today to sort of set the stage for I'm just trying to share my screen right now. To set the stage, I hope you can all see this, yeah, for the discussion that will follow. I'm not going to actually say too much directly about the project that will come through later in the day, but more about some of the background issues on the economic side, while my colleague Kyoko will talk about the specific gender issues. But on the economic side, I'll go through these issues here quickly. I hope that you will be able to draw the links later to the project and what we hope to achieve. But this is more stage setting to provide the background. But what's going on, firstly, with COVID in ASEAN? What are the likely economic impacts? How we need to look at this in terms of trade-offs, weighing up health risks versus economic concerns and economic costs. Then I want to focus in a bit more on the poor and why we need to be particularly concerned about them. I use the term poor to refer to all kinds of vulnerabilities. Of course, there's issues of gender involved, as we'll specifically hear about today, but also, people who are stateless, homeless, the whole gambit of vulnerabilities. So this is a catch-all phrase when I talk about the so-called poor. And then I want to talk about where we go from here, the post-pandemic recovery. And specifically, there are lots of issues, of course, in recovery, but I want to talk specifically about the role of opening borders, and then to quickly sum up. Okay, so this is a picture in ASEAN as of a few weeks ago. Things are changing all the time, but I think we can group the countries in ASEAN into 3 categories. First, we have the countries that are still struggling to contain community spread, and this has happened almost right from the start. And this is the Philippines and Indonesia, 2 very populous countries with very high rates of community transmission, and with spread still rampant. Secondly, we have countries that appear to have controlled or managed community spread initially, but are suffering new waves. This is Myanmar, a member of this study group, and Malaysia. They are now dealing with the new wave, and the situation in Myanmar is quite bad, unfortunately. Malaysia also seems to have quite significant daily infection rates. Then we have the other countries of ASEAN that appear to have managed community transmission. Now, we heard earlier from Dr. Sokempek that Cambodia has had its first case of community transmission. And of course, that's worrying, but it's nothing like what other countries are dealing with. So we should put things in perspective. I think it's important to control any outbreak of community spread, but there are degrees and measures of this problem. And I think all these other countries, Brunei, Cambodia, Laos, Singapore, Thailand, and Vietnam, belong to a group where community spread is still under control and no drastic response is required. Okay, now I'm sorry to rush a bit. I've limited time and a lot to cover. So I think this diagram is quite useful in understanding how the economic effects play out when it comes to this pandemic. In the top panel, we have the familiar flattening of the curve diagram, where when you introduce containment policies like lockdowns, you reduce the severity of the spread over time. So in the bottom panel, the dashed red line is if you do nothing. Of course, no one is doing nothing, but if you were to do nothing, you still get a recession because the pandemic reduces confidence, creates uncertainty, reduces investment. But the real negative impacts on the economy come from government responses to try and control its spread. So the dashed blue line shows you this big drop in economic activity or GDP loss from the lockdown or other measures, social distancing measures. But of course, that's a gross effect. In the real world, what we observe is the dashed green line in between the two, which is net of government support policies that look to mitigate the worst economic impacts of the containment measures. And these government mitigation measures vary by country in ASEAN. And this is a picture that shows you the shares of GDP spent to deal with the worst economic impacts of the lockdowns. And of course, you can see the countries with greater fiscal space and generally more resources have been able to spend more of their GDPs in trying to limit the pain from the economic downturns. Many of the Mekong countries have limited room to do this compared to the more developed countries in ASEAN. Right, okay, so now in this picture here, in this table, I have summarized the forecast from the ADB and the IMF on what we expect will happen this year and next year. The IMF expects that the world will contract by 4.4% this year, but rebound sharply next year, around 5-ish%. Now for ASEAN, it's not as bad as the rest of the world. I'll come back to that. It's expected to contract by about 3.5%. Both ADB and IMF think that. Now in ASEAN, the Philippines is the worst affected this year. The Philippines had a prolonged lockdown, but still did not manage to control the spread of the virus. Indonesia, on the other hand, which is having community spread to deal with right now, is the least negatively affected of the original members because it avoided a prolonged or complete lockdown. It chose not to. So it avoided one of the two crises. It avoided the economic crisis. It's still having a recession, but a small one. But it's, of course, still having to deal with the virus spreading locally. The Mekong countries are mixed. I think Vietnam stands out as having done very well in containing spread and in terms of economic outcomes. But then Vietnam has had the boost from restructuring of global supply chains, with a lot of investment coming into the country as a result of the US-China trade war. Cambodia is expected to contract this year as well. Myanmar, interestingly, is expected to grow without a recession. Of course, these estimates were made before the local, before community spread started to grow. So things would be different if they were redone today. And Laos also is expected to largely avoid a negative outcome this year. Right, this is a picture again from the IMF, expecting a V-shaped recovery still. China in yellow is the least affected and first to recover, as you can see. The worst, of course, are the developed countries in blue. They have the sharpest downturn. The developing countries, most of ASEAN and other emerging economies, are in gray. This is less China, and they are doing much better than the developed economies, and the world average is in between them in brown. Right. Now, those are all the forecasts. Now, what are the real numbers telling us? We have some actual data on GDP growth for countries that report quarterly estimates. And we can see here broadly that the worst was felt in the second quarter of this year, the light blue bars, where the bottom was hit in countries going through a recession. And in the third quarter, the dark blue bars, we can see that many countries are still contracting, but not as much as in the second quarter. Then, of course, you have Vietnam that avoided recession completely. But even there, you can see that the second quarter was the worst. Right. Now, if you look at more high-frequency data, it seems like the bottom was hit around May or June. This is trade data for broader groupings of countries. May or June seems to have been the bottom, and then sharp recoveries. Of course, the shape of the recovery depends a lot on how we deal with the virus going forward. For countries that manage it well, we can expect a V. For others, it may not be that clear or that resilient a recovery. We can expect U or L or even W-shaped recoveries. It depends on how we manage new waves or existing community transmission should new waves occur. Again, here you can see that for ASEAN or developing Asia, the downturn has been limited compared to developed countries because of our supply chains. There's been strong demand for electronic equipment produced in these supply chains in Asia, in ASEAN especially, because of the things like we're doing right now, right? Using Zoom and computers to go on with life, but also a lot of the health equipment and PPP equipment that there's been a lot of demand for that are produced in China and ASEAN. Right. So let me move on quickly now to the next topic of balancing health and economy. I think when the pandemic first started, we knew very little about what to expect, and we could be excused for panicking, for locking down economies to try and limit what might have been a disastrous health pandemic. Now, almost a year later, we know a lot more about how this virus spreads, and I think we should use that knowledge to guide what we do from here on. We have to be clear about what we're trying to achieve with lockdowns. Are we trying to eliminate the virus? Are we just trying to contain it or manage community spread? Or are we just trying to save our healthcare systems or just flatten the curve? This needs to be asked, and we need to try and answer that question before rushing to lockdown economies. We know that lockdowns can work under certain conditions. China is the best example, but also countries like Vietnam and Thailand have used it effectively. But we also know that they may not be necessary, as Taiwan has shown, and Hong Kong too. Hong Kong is having a new wave of spread, but when it first dealt with it, it did so without a complete lockdown and quite successfully. Now, in other countries, we have to recognize that lockdowns may not be feasible. In poor countries with large populations like India and Indonesia, in these countries where governments cannot afford to pay people to stay at home, then lockdowns are just not feasible. People will break the lockdown simply to survive. And I'll come back to this issue later. But finally, I think we have to accept that lockdowns are also not sustainable for prolonged periods in any country, rich or poor. So lockdowns have to be used, carefully and in a graduated way. We have to keep our ammo dry for the worst spikes. We cannot simply rush to lockdown economies every time we suspect community spread or there's a small amount of the virus appearing to emerge. And I think this is an important lesson now for Cambodia and other countries dealing with potential new waves. And this is because of the disproportionately large impact on the poor and vulnerable. Let me skip this section about SDGs and come back to it if there are any questions, except to make the general point that we are we are missing our targets. When ESCAP did this assessment in 2019, we are way beyond where we should be in achieving our 2030 targets. We've even regressed on some. And so what that means is that we have become more vulnerable to this pandemic. The lack of progress before the pandemic meant that its consequences were worse because of that, and also that the future progress will slow further as a result of the pandemic. So these are, very, worrying issues. The lack of preparedness has actually meant that healthcare systems, were strained in many countries. The lack of access to running water meant that a lot of the mitigation in poor countries, like washing your hands all the time, wasn't always possible, especially during lockdowns. The lack of digital infrastructure meant that school closures had terrible effects on the poor because they couldn't access online alternatives for learning, and the list goes on. Right. Now, I think the poor suffer both directly from the virus as well as indirectly from the response to the virus. Directly, as a result of malnutrition, they have weaker immune systems, and of course, they have limited access to healthcare. Now, interestingly, the experience in India suggests that being exposed to viruses in the past may actually prepare people better in dealing with this virus. But then that effect may be overturned through severe malnutrition, where being exposed to viruses in the past may be good for immune systems up to a point. But if you're malnourished, your immune system is so weak that in net terms, you're worse off. And but the main effect comes from the lockdowns, actually. The poor cannot always work from home. Many of them have no homes. A lot of them have informal work and live on day-to-day basis, scavenging, etc. And all of these things impact them severely during full lockdowns, when they're not allowed to pursue this daily wage. And of course, when they can't receive the kind of support that we expect in more developed countries through social safety nets. Now, these countries, these people don't receive the support in the best of times. You can't expect that they will now in the worst of times. And then there are lots of long-term effects we need to be concerned about. The World Bank has already measured this or estimated this, how decades of success in poverty reduction may be reversed in this 1 year, one horrible year that we're going through. And then even when we get over this pandemic with the vaccine on the horizon, the poor may not share equally in either access to the vaccine or in the economic recovery that's forthcoming soon, hopefully. This is the experience with all previous crises as well. And then the loss in education, access during this period may perpetuate an intergenerational cycle of poverty, again, leaving behind permanent scarring on the poor. And of course, inequality will rise. Right, now finally, let me talk about recovery. There are lots of issues here to be handled, and I'm sure we'll come back to them in the panel discussion. But let me focus in on one aspect, which is border opening. We know that we can see here on the left chart, left panel, that international travel restrictions have continued to remain in place after they were raised initially following the pandemic, unlike a lot of domestic restrictions which have been eased. And the impact on the right panel on tourism and related sectors has been devastating, right? So that made sense to raise border restrictions as a start. But should we still keep borders closed, especially when domestic restrictions have been eased quite significantly across most countries, right? So it may be time to narrow the gap between domestic and border restrictions. I'm not talking about opening up freely or completely, but in a calibrated way that reduces this gap between domestic and border restrictions. This kind of rebalancing, I think, can support economic recovery without significantly raising health risks. And then going forward, we can consider how we might have a travel bubble among countries that have contained this community spread quite successfully. Maybe a subgroup of the Mekong countries or broader ASEAN travel bubble of countries that have contained community spread as a way of actually moving forward from the bilateral deals that are taking place right now. And Thailand, as many of you would know, just a couple of days ago, has decided that it will allow tourism from any country because they recognize that as long as you observe the protocols, the testing and the 2-week quarantine, there's no need to actually ban entry from any country. So I think that's a brave move, and I think it's a welcome move. But if you're not ready to go so far, at least open up to countries that have low community transmission, and you can even impose quarantine if you must. But there's no reason to ban travel from those countries, as some countries are doing. Right. So let me conclude now, as I've gone a bit over time already. I think going forward, we should be careful about how we respond to new waves of this virus should they occur. Even the WHO has told us now that lockdowns serve mainly to make the poor even poorer. This was not their message at the start, but everyone learns from experience. I think targeted measures are to be preferred to general lockdown measures, unless, of course, your healthcare system is at risk of being overwhelmed. In that case, you have no choice but to lock down. But in every other case, I think we should be very careful about how we proceed in terms of our responses, now that we know a lot more about how this virus spreads and also how lockdowns affect us. The poor have a very large negative impact from both the virus and the lockdowns, and we need to recognize that. Even with the vaccine on the horizon, to give you one example, TB and waterborne diseases have cures, yet they still kill more people than COVID has so far in India today. We need to understand that ground realities are such that COVID is only one of a number of deadly viruses and diseases that poor countries have to deal with and have had to deal with for many, many years. Now, balancing health risk and economy in countries where there are lots of poor people is very important, especially when macroeconomic policy constraints operate. In many Mekong countries, fiscal space is limited. This is simply a sign of the transitional nature of the economies and developing nature of the economies. And monetary policy can also, excuse me, be constrained if you have dollarization, as you do in many countries in the Mekong. And finally, I think we have to accept that the virus is not going to be immediately overcome with the vaccine. This will take time because turning vaccines into vaccinations will take time, especially when the vaccine is likely to deal with the disease, but not the infection. So people who are vaccinated may still be able to spread the disease. It's just that they're less likely to suffer the infection or the disease. So they are less likely to die from the infection, but they can spread the infection. So until we get to herd immunity, which will be some distance away because you need to vaccinate at least 60% or so of your populations, we cannot expect that this vaccine, cannot wait for this vaccine before quarantine-free travel is considered. So the time to open borders, I think, is now, to start thinking about it right now and not waiting for the vaccine. So with that, let me stop there, and I look forward to your questions, and thank you for your attention. Thank you very much.
Thank you, Dr. J, for your insightful presentation. The 5-minute Q&A session is now open. I would like to hand the floor to Mr. Rodwatana to facilitate the Q&A session. Yes.
Okay, Jay, thank you very much for your insightful information running down from the current situation of COVID-19, especially in ASEAN, a few more challenges that we will have to deal with moving forward, and also some recommendations, especially on starting rebalancing between the health crisis and also the economic impacts of that, and especially on the thinking of sectors in many of these countries. With the time we have for Q&A, I think we have two questions coming in. The first question, we have three now. The first question basically asks about the varying impacts of lockdowns. Basically, we have seen that variation, and can you tell us a bit, what are some of the factors that explain the difference, though the varying impacts of lockdowns, either across country or within different groups in a particular country?
Right. Okay. Let me just be quick because I know I've run over time. I think as I started to explain during the session, in poor countries, let me start by saying that if governments want to force people to stay at home, then they have to provide them the means to survive. You cannot do one or the other. So, if you lock down or force people to stay at home, you need to provide them with the resources to live while not working. Now, if in poor countries, this has not always been possible. So you cannot expect that people will observe lockdowns. They will break lockdowns if it's a matter of life and death. I think the debate has been skewed by the discussion in developed countries, where it's couched in terms of lives versus livelihoods, particularly in the US, right? And there, people think that you're being selfish if you think that you want to, favor the economy because people's lives are at risk. And that might be true in rich countries. But in poor countries, lives and livelihoods are one and the same for many people. You cannot live if you don't have a livelihood because the government will not provide you the substitute income. And so I think that's where the difference lies. And that's what we need to consider, those sorts of ground realities before we rush to lockdown economies. Let me stop there.
Thank you, Jay. I just probably want to follow up a bit on that too. I think when we talk about government intervention, and probably most, if not all countries are doing that, but small countries, one of the challenges for small country is the fiscal space. So what is your take on that?
Yeah, that's right. So I think, as I said, resources are limited. If you're looking at the Mekong region, in this case, a lot of government budgets are financed by ODA largely because domestic revenue raising capabilities are still constrained. And so, that's a reality we have to deal with. And, this during these times, it is very difficult to expect increased domestic revenue raising or to actually expect too much from the development community as well, because a lot of the donors are themselves dealing with this global pandemic. This is not an isolated problem. This is a global problem, and they themselves are under fiscal stress. And many developed countries are now building up their debt burden, which will have to be financed by future generations. So times are very hard. And so this is another reason why we should be very careful about this balance between health and economy. And we cannot simply think that there's a golden rule here that works in the West, works in developed countries, that can also work in developing countries. Local conditions suggest that, while there are many ways to try and mitigate spread of the virus, and those need to be considered in terms of how they might impact livelihoods.
Okay, I think because the 5 minutes time is almost up, but I think there's two more questions which I think is relevant. Linking to that is the role of developed countries. What is your take on this, the role of rich countries to assist the poor countries?
Right. I think, of course, we hope that, there will be a fair distribution of the vaccine. That's what we're talking about, I think, as a key issue going forward. In addition to, of course, aid packages to help with recovery. But as I said, we can't expect too much because these countries are themselves facing constraints on the fiscal side. But will the vaccine be distributed fairly? Almost certainly not. That I think we have to accept. But what can we do to try and increase the access of poor countries? The UN has a program. There must be other measures. Hopefully, some developing countries can actually start manufacturing this vaccine over time. I think that will be, the real solution to mass access of the poor to this vaccine, and we hope that that will happen. I think, Vatana, we probably should move on to the next session because time is running out.
Yeah, sure, but I think there's one more question. I think it's also relevant too. I think this one is about the growth in low-income country like Myanmar in 2020, a quick recovery despite closed border and very low fiscal stimulus. So how we can interpret that positive growth?
Yeah, I must say that I'm also a bit surprised with the growth numbers from Myanmar. I think, I think it's not unfair to say that, the data need to be looked at very carefully. There have been problems with data before in Myanmar and in many countries. So we need to be studying that very carefully to make sure that they're consistent with across the board, that the numbers on GDP growth are consistent with other output numbers across sectors and so on. And also the fact that Myanmar is struggling with the community transmission of the virus at the moment as well. So for it to be the best performing country in ASEAN seems unusual. But there is sometimes not being so open can serve as a boon. It can be an advantage at a time when the whole world is, growing slowly. And you have a domestic market that can sustain you, that has sustained you in the past. This can be a positive, like in Indonesia as well. A large domestic market has been a positive in minimizing the worst effects of this global slowdown. And that could be operating. A large agricultural sector also helps during these times, and Myanmar has that also. So there are positive signals there to support less than severe impact on the economy. But I'm still a little bit surprised that it's the best performing in ASEAN. We'll have to wait and see.
Okay, thank you, Jay, for the answer, and also thank you, participant, for the questions. I would hand the floor back to our MC for the next presentation. Thank you, Jay.
Thank you very much.
Thank you, Dr. Jay, for the answers, and thank you, Mr. Watana, for your facilitation as well. Next, I would like to invite Dr. Kyoko Kusakabe, Professor of Gender and Development Studies from Asian Institute Thailand of Technology in Thailand for the presentation. The topic is Reflection on the Impacts of COVID-19 on Gender Lens. Dr. Kyoko, the floor is yours.
Okay. Thank you very much. Thank you very much for the organizers to provide me this opportunity to share with you this issue on the gender aspect of this pandemic. I think Jay have already given the very nice, good, comprehensive a picture of the current situation. My focus is on how this situation, the COVID-19 pandemic, affects gender, women and men differently. So I will be focusing on these 6 issues for this session. It's more from many of the data is also, some are guesstimates and some are anecdotal, but then still we do see a certain pattern in the gendered impact. So the first one is loss of employment. So as Jay was saying, the economy is going down. ILO have estimated that 140 million full-time jobs are going to be lost. And then what UN Women estimate is that women's employment is higher, much 90% more at risk than men in getting lost. So there will be the impact of pandemic to women's employment is larger than that of men. Especially this is because some of the sectors that women are concentrated in are very much affected by this pandemic. For example, garment factories, garment industry. So the demand for clothing, because of the lockdown, everything have decreased by 50%. And this have led to many factories closing down and all that. So, but then we also know that in Mekong region, like Cambodia, Myanmar, and all that, there are a very high percentage of women who are working in garments. So when the garment industry goes down, and this the impact to women's employment is very severe. And so the same thing goes for Vietnam and Laos. Also, another sector is the informal sector in general. So this was also mentioned by Jay, but then the unemployment, the economic impact of the informal sector have been disproportionately higher than that of formal sector. This is also more severe because informal sectors are often excluded from social protection schemes. And then so informal sector also, the tourism sector that has been affected by the pandemic is very much, women are very much in the informal sector of the tourism sector, including like market vendors, service providers, food. And so these are all the people that are affected. So 94%, a very high percentage of women are working in this informal sector, but then the jobs that has been lost in this sector have been much higher for women than for men. So, so this was another reason why women's employment have been affected more in the pandemic. Also, the women's entrepreneurs, they also face more difficulty in coping with the pandemic because they have less assets to cope with this kind of risk and shocks. So they have less assets that they can use in order to get loans. So they have less means to avoid the shock of this pandemic. Also, we have vulnerable sectors in this under this pandemic, especially like sex workers and domestic workers. The whole lockdown, which also targeted a lot on this entertainment industry, have made sex workers' workplace disappear. And since they are also not covered by many of the social protection, and because of the social stigma, they have been totally excluded and very much affected. Domestic workers, also where the migrant workers are also concentrated, have also lost jobs in numbers. So again, there are pockets of a group of people, especially women, who have lost jobs in numbers. The second issue, which is very largely discussed, is the increase in domestic violence. So you can see here, the UN Population Fund said that this pandemic have caused 15 million additional gender-based violence cases. So SCAP also estimated that 20% increase in violence. So this is a phenomenon. This is a large impact of the pandemic. So this the increase has been attributed to this increased exposure to perpetuators during lockdown, because they have to always be at home. And then they have, and then the stressful environment because they are always at home, or because they are not, because they have financial difficulties, or because of the unemployment. So these have increased stress, which again leads to violence. And this kind of stress is also affecting women more than that of men, as you can see here in the percentage of people who have reported mental health deterioration. Also, this kind of lockdown have reduced the people's access to support services, because they are not going out. The service providers are not coming to their houses. The government offices are closed because of the social distance and lockdown and everything. So it has become much more difficult to get access to services. Also, child marriage is another form of violence. The school closure and the children staying at home, students not going to school. Like in Myanmar, 50% of the children stopped going to school. This kind of children staying at home, especially girl child staying at home, exposes them to a risk of earlier marriage. So the child marriage, there have been anecdotal evidences that child marriage have gone up. And so that's another form of violence that we also need to note. There has also been increase in cyber harassment, because people are locked down at home, and then they are online more longer time, and that would also expose them to digital violence. And then again, there is little support that is being provided because of the lockdown. The third issue is about food security. There have been, because of the economic difficulty that many of the poor households are experiencing, they have to decrease their consumption. The first thing, the most common thing that they talk about is that they decrease food consumption. So like, for example, in Myanmar, they say that 80% of these people have decreased food consumption. Now, so they have fewer meals, there's nutritious food. And so when this kind of thing happens, many times it is the women who eat less, who eat less frequently or less nutritious food. Also, the burden is going to be on women to manage the household food consumption, because they are the one who is responsible to make sure that everybody have something to eat. So the pressure for them is quite hard. This is exacerbated by the lack of remittance income, because migrants are coming back, and then now they also have to feed the former migrants, as well as cope with the decrease in income. So that has made the situation even much harder for the poor households, and decreased the workload for women. So overall, there is an increase in women's workload. ILO have estimated that there is a 13% increase in unpaid care work for women after the pandemic. Because because of lockdown, everybody is at home, so there is much more household work that needs to be done. Also, the daycare is closed, the schools are closed. So now all the child care have to be done at home. Also, sometimes people get sick, especially with when the healthcare services is not enough, and then the sick have to be taken care of at home. Again, this increases the workload for women at home. So you can see here that there was a study in Myanmar which have looked at the so-called productivity loss, and women have noted this kind of increase in workload, whereas men increase in the working hours as the cause of productivity loss. So unpaid domestic work have increased, and then whatever increase that women could not handle was handed over to daughters and sons, but very little have been handed over to husbands. So the sharing of workload has been uneven. I also would like to highlight the issue of healthcare workers, which are separately from other employment and other things, because during this pandemic, there has been a lot of praise about the sacrifice that the healthcare workers are doing and this and that. However, there has been very little attention to the actual improvement in the working condition of healthcare workers. So it's only like word praises, but no real improvement which has been given to these healthcare workers. You can see here that 70% of the paid global healthcare workforce are women. So it is also a very much feminized workforce, which have a very high gender pay gap. So you can see here that gender pay gap in health sector is higher than in general, 28% in health sector, whereas it's 16% overall. So the healthcare workers work in bad condition with low pay. And then, so this kind of thing did not improve under pandemic, even with all these praises about the sacrifice of the healthcare workers. Also, healthcare workers suffer from physical violence by patients and visitors. So it is a very harsh working condition. Even with this, they still also experience stigma because of the proximity to the sick. So we have been hearing how the children of these healthcare workers are not able to go to the daycare centers because the other parents are not really accepting. So this kind of stigma still remains. And then which is the people who are even more disadvantaged are these community healthcare workers who often work voluntarily. And these people are excluded from many of the support that or care that might have been extended to the paid healthcare workers. So these people do things voluntarily without any support. Oftentimes, again, we praise them, but then there have been very little tangible support which has been given to this kind of healthcare workers. So the access to support is very important when this kind of impact of a pandemic happens. And then the government have also given some economic stimulus and then some kind of support. All the countries have done some things to support, to mitigate the impact under the pandemic. However, there are problems. For example, women have less access to information because they have lower digital literacy. Many things that might come through internet, women might have less access to this kind of information. Also, UN Women Study have shown that women have less access to medical services. Like Cambodia and Thailand, women are less able to go to seek medical care compared to men. Also, women have less access to state support because of the existing gender bias that is already there in the state support mechanism. For example, many of the women entrepreneurs do not have formal registration or do not have asset, so they cannot access state subsidized loan as easy as other larger organizations and companies which have the registration and assets. Also, many of the state support with cash transfer are targeted to households, not individuals. So it is given to the household, and then many times it's a head of household, and head of household are normally men. So, so it's not always the case that household lives happily ever after. So we do see that if things are given to head of household, we are not very sure how it's being distributed within the household. So that kind of household-based support have not been improved even under this pandemic, even though many of the women activists have been advocating to change this kind of system. Also, some of the support that has been given in many countries are tax-based. So the deferring tax payments or pension payments that has been introduced in Laos, Myanmar, Vietnam, they have introduced this kind of support. Again, now these benefit the formal sector workers and enterprises, but not the informal sector workers where poor women are concentrated. So many of the support might be missing out many of the poor women in the society. And then some of the support is also targeted to childcare or like health and domestic violence in some way, but then little attention have been given to economic opportunity for women. So it is economic opportunities like for everybody. Yeah, but then okay, maybe domestic violence for women, but then there is very little thoughts given to the gendered differences in terms of the economic opportunity needs. Also, very importantly, women, there is very little women in the decision making of what kind of support, the design of support. Women are very much less represented there. So in conclusion, what we are seeing here is that this kind of gendered effect that we are talking about now is not going to go away after the pandemic. So it might be a long-term effect. The impact might stay. So this loss of opportunity, loss of employment, whether the women can really come back, the poor woman can come back or not, is very questionable. The loss of education, food, malnutrition, this can also have a long-term effect on the children. Experiencing violence, the trauma that they experience during this time, again, can be very long-term. So there's so the pandemic is not going to finish after the vaccine is out. So we have to take note of that. Also, women's absence in decision-making position is a real problem because, so that's why involving women in research and policy making is extremely important, which I think this project is trying to do this very explicitly, which is very important. Again, what we see here is that there's less data information on gender issues. Many are anecdotal, many are observations. So for example, statistics on gender-based violence and its impact is very much lacking. So we do need more concrete, strong evidence on the impact of gender-based violence. Gender disaggregated data, including informal sector workers, is also very much lacking. And so not only welfare, but also political and economic opportunities for women, this area is also very much lacking. Or how to change the status of women workers, all these healthcare workers, both paid and unpaid. How can they, because we now know how important they are for us, but then their status is still very much in the bottom of the pyramid. How can this this kind of status be transformed? So this kind of transformative studies is very much needed. So where we find that this project that we are looking for and the longer term impact, gendered impact of the pandemic is very much needed. And it's very exciting that this project is being launched at this moment in time. So these are the references, and thank you very much.
Thank you, Dr. Kyoko, so much for your very significant reflection from gender lens. Now I would like to hand on the floor to Mr. Rawatana to continue facilitating in the Q&A session. Thank you.
Okay, thank you very much. Once again, thank you, Professor Gyoko, for that perspective. And I think that with the evidence and the data that we have by now from different key players, it comes to conclude that the impact has a disproportionate effects on men and women in terms of employment, in terms of income, in terms of unpaid works. And I think one of the findings on gender disaggregated impacts of this pandemic by the World Bank in many countries is that women are more likely to lose job or to stay home because of this. And that's I think incorporating gender into our analysis is also an important part under this project too. We have a few questions. Number one, I think you briefly mentioned about that, but can you probably give your take on some practical strategies? How can we deal with the constraint for women in the recovery process?
Okay, So I think that's what we are. This project is also trying to come up with what will be the best practice in terms of supporting, transforming this problem, because it's the pandemic. This kind of gender effect under the pandemic is caused because of the gender discrimination and disparity during the non-pandemic time. So because of the gender disparity that we have before, that's why we're having this kind of situation. And then through this kind of situation, the disparity can be even worse. So that is the worry that we have. And then that's where we need to take into consideration, how can we mitigate that? So for that, we do need more information, like, for example, the study on the gender-based violence and its impact under this pandemic is very important. And involving women in decision making and for policy making is extremely important as well. So so it's not only about pandemic, it's really about the gender disparity in the society, and then how to transform that is a core part to address this gendered impact in COVID-19.
Okay, one more question is basically on the role of NGO operating at local level. Given your experience, what do you see some of the important role of these NGOs in helping addressing these gender constraints?
I mean, NGOs are the most very, very important, because as I was saying in my presentation, there is a lot of problem or limitation in the government policy or the government's program or support programs. There is a lot of people who are left behind actually by government support. So flagging that flagging which people are being left behind is very important, and NGOs are very good in doing that. Also trying to address and then coming up with suggestion in how we can reach out to people who we are not reaching out is again also a very important area to role that NGOs can play. So actually government NGO collaboration partnership is extremely important in order to make sure that this pandemic is not going to have adverse effect on gender disparity.
Okay, I think probably this is I think the last question, which I think it's quite interesting in relation to the vaccine. And the question basically it's about whether is there any gender constraint when it comes to vaccine distribution, and if that's so, whether the government should actually consider gender as one of the important dimensions to determining who will get the vaccine first.
I think in many countries they prioritize the health workers to get the vaccine first, because they are the most exposed, that they are the most vulnerable people in terms of they're most exposed to the sickness. And so it's very so they should be prioritized. But then when we talk about health workers, we also have to make sure that all kind of health workers, not only like highly paid doctors and all that, but then also people who are in the community health centers, people who are working in the villages as community health volunteers. These are all health workers. And then these lower level health workers, there are more women who are concentrated. So we have to make sure that when we say health workers, everybody, all these different people, paid, unpaid, whatever the pay is, have to be included as a priority.
Okay, thank you, Gyoko. I think given the time limitation, I would like to conclude this session, and I will hand the floor back to our MC. Thank you. Thank you, Dr. Gyoko.
Thank you, Dr. Kyoko, for your answers, and thank you, Mr. Watana, for your facilitation as well. Next, and the last session is the panel discussion, which will be moderated by Ms. Gillian Dowie, Senior Program Officer at IDOC. Ms. Gillian, please.
Great, thank you very much. And thanks also to Jay and Kyoko for the, is it on? Yeah, for the excellent overview of the challenges in the region that the project, of course, hopes to take on, at least to some degree. I'm going to get right into the overview presentation of the initiative itself, since we're short on time, so I'm not going to give a kind of a spiel. And we'll get into a few questions for the different institutions right after that. So the first thing is I'm going to turn it over to Vathana Roth from the Cambodia Development Resource Institute. CDRI is the coordinating institution for this initiative, and Vathana is the director of CDRI's Center for Development, Economics, and Trade. He's going to walk us through the initiative first. Vathana, over to you, and then we'll get into questions after. Thanks.
Okay, thank you, me once again, and thank you, Gillian, for the brief introductions. I will start this panel discussion by giving you a brief walk through the projects. Again, because I'm coordinating the project, so I will just give you a brief of what we aim to achieve under this project. First and foremost, I would like to thank the International Development Research Center of Canada for sponsoring this 3-year project with having CDIs coordinating the projects and other partner institute in Cambodia, Laos, Myanmar, and Vietnam. I'm sure that by now there are many players in these countries who try to provide the assessments on the COVID-19, and also there has been a serious discussion on what's the future will entail. But I think at least when it comes to impacts and recovery, I think there is additional demand from policymakers and all stakeholders involved to know more about what is the impacts on different groups in the societies and what lessons that we can learn across countries in order to have a kind of resilient recovery moving forward. So that is basically the objective of this project too. So to be specific, under this project, we have 3 main objectives. First, of course, is to provide this assessments, both rapid and post COVID-19. You might probably ask, how do you define post COVID-19? But at least we see 2021 probably as a year that we can hope that economies in these countries and countries around the world recover, especially with the news of vaccine rollout, even though we have a few challenges when it comes to vaccinations and distribution, as Jay mentions. So this project, we continue to provide that our evidence on the impacts, and also try to contribute to the efforts of monitoring recovery. And I think that is important for policymakers and other key actors in understanding how the recovery looks like, and along the way how marginalized, vulnerable groups, women's are being incorporated into this recovery process. The third objective is, of course, partnership and cooperations. And we also aim to learn cross-country lessons from the other country too. I think that is important for the region. And that is why we build up this particular consortium. So these are the main objectives of the projects. In terms of the questions, now there are 3 pillars to the question that we are going to answer. You might probably say that, oh, too many questions to focus on, but I think these pillars are important in trying to contribute more to the understanding of the impacts and also the recovery as well. The first pillar focus on macroeconomic responses, and some of the key areas that we're going to look at are first kind of the policy response that the government have implemented so far, and what are the impacts of that response, and how effective those responses are in dealing with the current crisis. And we also, in this, we also look at the recovery policy as well. So trying to understand types of policy that government can actually use in order to ensure that we have a resilient recovery moving forward. So this is on the macro part. Pillar 2 focus specifically on social protection and small and medium enterprise, micro, small and medium enterprises. And I think as the two presenter mentioned about the disproportionate impacts of COVID-19. So we have vulnerable groups, we have women, workers in the informal sectors who might not be able, to, get the benefits or to access to some of the support that the government have been implementing, and also who are in the category of most vulnerable toward this crisis. So we basically, again, we're trying to understand what are the impacts on them, and also moving forward, how can we incorporate these group of people into a wider policy discussions and also policy implementation as well. And that is what Gyoko was mentioning. And I'm happy to see that our participant also asked that question too. So I think that's indicate that there's a real demand to understand more on how to incorporate these groups into policymaking. The third pillar, more on governance side and coordinations. Basically, we try to understand how different actors are involved in both the response and also the recovery as well. There's one question probably specific to our colleagues in Myanmar, basically on the election part. Zau might probably explain this a little bit more when we enter into the panel discussions. Of all these pillars, I want to make sure that gender mainstreaming will be central for us. So gender is trying to understand disaggregated impacts between men's and women's, and also gender sensitive analysis will be the central component of all these pillars. And as Gyoko mentioned, and also the data that comes up, women's might probably be the most impacted groups compared to their counterparts. So this is roughly the question that we are going to examine. In terms of sector, we try to be sectoral focused. I think, as you know, that different country might probably, the pandemic might probably impact different sector in different countries. For example, in Cambodia, tourism is probably one of the hardest hit sectors. So in order to avoid trying to cover every sectors of the economy, we are trying to be more focused and examining response and recovery in these three sectors: agriculture, manufacturing, tourism, and hospitalities. And it should be noted that each country will examine two of the three sectors, resting on the principle that the sector are being impacted significantly by the pandemic, and also on the principle that not trying to reinvent the wheel, because as you know, there are many key players who also are working in that sector too. So we are trying to find gaps where okay. In terms of our approach, we are trying to be as participatory as possible. So multi-stakeholder approach will be adapted with the following indicators. Now, as Gyoko mentioned, from the impacts of the pandemic from the gender lens, there are a number of areas that we can look at. And of course, we cannot really cover every indicators that provide some more evidence. But at least I think this is what we think are some of the key indicators that we are going to look into that. I think the other, except the last one, probably is kind of like common indicators that we are looking at. But the last one, which is the intra-household relation and resource allocations, is one of the indicators that we also want to contribute to that too. So it's more on, you know, unpaid care work that Yoko mentioned about, resource control and distribution among male and female household members. That we also want to know more moving forward. My last slide touch on the consortiums. First of all, I would like to thank the director of the Partner Institute, Zoe Poupet and Dr. Tang, for joining this consortiums. And what you can see on the slide is the structure. So CDRI is coordinating that of this projects with our partner institute, CSSD, National University of Laos, and CAF in Vietnam. And we also have two technical advisors, Gyoko and Jay, who are presenting here, who will be helping us with research design and also producing high quality outputs going forward. And I would also like to stress the fact that we are trying to be as gender inclusive as possible in terms of team compositions, making sure that each country will achieve at least 50% of female researchers and personnel in the team compositions. That's just want to stress women involvement, not only in the policy makings, but also in the process of generating evidence for policy making too. So with that note, I would like to conclude that brief synopsis of the projects and look forward to more question and clarification. Thank you.
Wonderful. Thank you very much, Vathana, for the overview. So now we can get into the panel discussion with a few questions of my own to start with. As everyone online thinks of questions that they want to ask, I also want to remind you that this is actually the launch of an initiative. So feedback is also welcome to help shape data collection and other processes, because this is just really at the outset. So do think in that way as well when you're coming up with ideas. I'm going to do really quick introductions to the panel. We've already seen everyone's name before, and then I'm going to get into questions. So Vathana is going to remain on the line to represent CDRI, and we're joined by Dr. Poupet Kiopilavong, who is the Vice Dean of the Faculty of Economics and Business Management at the National University of Laos. We also have Dr. Zhao, the Director of the Center for Economic and Social Development, or CSD, in Myanmar, and Dr. Nguyen Tang, the Director of the Center for Analysis and Forecasting in Vietnam. So welcome, everybody. The first question I want to ask is for Zhao in Myanmar. In Myanmar, early in the pandemic, we saw that there was a large influx of migrants returning from neighboring countries, especially from Thailand. How do you propose in your project, I have the benefit of knowing a bit more about this, how do you propose in your project to take this experience into account? And how do you hope that the evidence that you generate will be used, and by whom? And how will you capture the gendered experience of the returning migrants that in the process of returning, but also since then, and their sort of aspirations for the future? So,
yes, thank you, Gillian, for asking me a very good question. In fact, migrant workers are very much important economic stakeholders in Myanmar. As you know, we have about 4 to 5 million of migrant workers living outside of the country. I think we are the highest migrant sending country within the ASEAN. We have our migrant labor working and living in Thailand, Malaysia, and also China lately, and even Laos. It's quite a surprise for me to see that Myanmar migrant workers are also, living and working in neighboring Laos, where we have a very similar development backgrounds, and the wage levels are quite similar. But I think that really makes migrant worker returns to the country, especially during this time of COVID-19, which a very alarming issues for us. For instance, from the very first pandemic wave in March, April, we have received about 200,000 migrant workers coming back from Thailand alone, which added to another 200 to 300,000 workers who also lost their job. So I think almost double the unemployment figure within the country, which indicated with all kinds of burden for both the government and also the receiving families who also rely very much on the remittances that they tend to receive from these migrant workers before the pandemic. So the immediate impact, it's a reduction of the remittances coming back to the economy. And in 2018, the World Bank estimated about 3.8 billion US dollar worth of remittances coming into the country, which is nearly about one-third of the export revenue that we receive. And then also in that year, it certainly exceeded the official inflows of the foreign direct investment. So in that sense, the remittances from the migrant workers are really important for our macroeconomic stability and for our balance of payment situation. So in that sense, we hope that our research will inform the government about the impact of migrant returns, not just on the local economy, but also on the macroeconomic situations. But one thing that which I also like to draw upon, it's the high percentage of the women migrants who are living and working in Thailand, and then they are also coming back, and then they can't really find a suitable job in the rural areas. So I think their vulnerability, especially in the time of COVID-19, is something that we need to address them. But we also can't forget about the migrants who are now still struggling in Thailand and Malaysia. They opted to stay there mainly because our pandemic situation in Myanmar is not so. It's very worrying because we are the third largest affected economy in terms of morbidity and mortality rates within the ASEAN. So, the migrant workers thought that it's better to stay behind in Thailand and Malaysia rather than coming back to the country where they may face both COVID and also the unemployment and burden for their community. So, but unfortunately, most of them will also lose their legal status by extending their stay in Thailand or Malaysia. So they will become subjected to all kinds of, immigration problems, maybe possible harassment. So in these times, our social protection needs not only to cover the vulnerable groups within the country, but especially the vulnerable groups outside of the country, especially in these neighboring economies. So in this sense, our migration problem, especially in the time of COVID-19, becomes more of a regional problem, and we need to, in this sense, that we are privileged to be part of the regional partnership on this sort of research, and that we should be able to find more information about these migrant workers, and that we should be able to advocate for better policies to protect these vulnerable populations outside of the country too. Thanks, Jimmy. Back to you.
Wonderful, thank you, Zau. That's actually a really good point to bring up to remind us that we're just talking about migrants who have returned, but there are also people who are left with sort of uncertain statuses in different countries that also need to be taken into consideration. I think it's interesting that you mention the number of migrants you sort of realize had been in Laos, because I had a similar question that I want to ask to Phuphat now, because Laos has a similar experience of having many migrants outside of the country, many of whom did return early in the pandemic, and many of whom have stayed back in the country of origin, particularly Thailand, maybe southern China. Phuphat, can I go over to you to also reflect on the knowledge gaps on these workers, particularly from a gender perspective, and how you hope to engage sort of partners and decision makers in the research in Laos and perhaps in other countries as well.
Thank you so much for inviting me to join this, Jane. We also have a big challenge and problem like Myanmar because a lot of the migrant is come back from the Thailand. According to the record, this is more than 130,000 is came back from the Thailand, but still more in the Thailand. So that data is not really clear, but I think that we have some number that make formally registration in the Thailand, but informal sector and so on, we don't have much kind of data. The big challenge and question is that because of the migrants come back from Thailand, and definitely they're going to lose their income and limited from the Thailand. And another big challenge that I'm thinking is how the migrant can find a job, because some of them, they also have some skill, and try to rematching about the labor market in domestic. I think this is very, very important. So as you know that recently we have now developed with partner with foreign FDI, special economic zone. That's that kind of development also they need the labor. So but in the SE special economic zone, they need the labor, but some of Lao labor went to Thailand to work, and something is like a mismatch demand and supply. That is also the new challenging is how we can this research can help the policy maker to come up with appropriate policy to how we can maximize the use of the migrant for the economic development and industry development in Laos. I think there are some of them is very, very skillful in many areas. Thank you.
Wonderful. Thank you, Phuket. So the next question I have is for Tang in Vietnam. This kind of changes gears a little bit and maybe goes a bit more into the macroeconomic approach and to an extent the sectoral approach. But how do you propose to assess the degree to which policy responses, both at the economy-wide level and in specific sectors, have been successful in mainstreaming gender? And from this, what role do you hope to have in ensuring and sort of helping to ensure an inclusive recovery in the development of a recovery pathway? And what role will you as researchers play in moving towards a gender responsive recovery? How do you see yourselves in that process?
Okay, thank you, Gillian. I think your question is very important. And you know that in Vietnam, since the beginning of the pandemic, the government employed a number of measures, including fiscal policies. For example, there was a support package to defer tax and payment of land use for enterprises. And there was also bank loans with zero interest rate for firm to pay workers in order to avoid, how could I say, layoff of their workers. And in particular, the government also introduced a social protection package, so-called relief package, which was roughly $3 billion US. And also other things like electricity price reduction. So there are a number of measures that were employed by the government to support the most vulnerable segments of the economy and the population. And but actually there is no explicit target on women. So based to to some extent, we can say that those macro policies are gender blind, because policymakers should perceive people, for example, the social protection package, relief package, the government support whom? People with married, poor and near poor households, formal workers who have lot choice, and to some extent, informal sector workers. Those groups are perceived by policymakers as most vulnerable, but according to some studies, including the study by UNDP, they point out to a number of vulnerable groups that are missed or underserved by the relief package. That is, families of young workers, especially those with children, single mothers, and those without savings and living in rented accommodation. And there's another group that is underserved by the relief package, or is families with members who have serious illness, or with people with disability. So those groups are actually very very vulnerable, and in those families, I think women take a disproportionately high burden to take care of the children and take care of the elderly. So I think that the macro policies up to now are quite good in targeting the traditional, how can I say, vulnerable groups, right? Poor, near poor, people with the marriages, but gender is almost blind. And now we interpret gender equality not only about targeting female-headed household, but also household with small children and with the elderly, right? So generally those groups are still underserved in the relief package, not to mention other, how can I say, macro packages, fiscal policy. So in terms of our contribution to this process, identifying the gaps in the response by the government, we think that we can make our contribution in a number of, how can I say, dimensions. The first one is that, as Kyoko mentioned that, and also Vatana mentioned in their presentations, that this project made gender a kind of integral part of the research process. So we try to integrate gender into every analysis to the maximum extent possible. And the second is that we think that, I think given that the fact that there are quite a number of players in the areas of studying impacts of COVID-19 on the economy and society, I think one of our contribution is, it was mentioned in the Kyoko presentation, is that non-income dimensions of gender equality. So because in Vietnam, there are quite a lot of Vietnamese and international organizations that do analysis of, how can I say, gender desegregated impact of the pandemic on incomes, on employment, right? And Vietnam has very good data set, particularly labor force survey, which is conducted every quarter. So we try to be, as complementary as possible to those initiatives by focusing on non-income dimension of gender equality to make sure that the recovery process, which is already underway, really gender sensitive, in the sense that Kyoko mentioned about things like domestic violence, intra-household decision making, or unpaid care work, right? So I think that this is what we envisage for our research in this next phase, and we think that we can add quite a lot of value to the policy making process, evidence-based policy making process, and we try to engage with women representative organization during our research process, together with other, the private organization from the private sector and non-government organizations. Thank you.
Wonderful, thank you. And the note about engaging with women's organizations in the process also. So there's a comment that came in about the importance of coordination with different groups and who's involved. And so I think that that's a really critical piece. Hopefully we can come back to it a little bit later again. So the last question I have in this round, the first round, is for Vatana. Informality has come up already in this event a few times, and in Cambodia, there's a very large informal economy. A couple of years ago, the ILO reported that 93.1% of workers in Cambodia work informally, and women make up a large proportion of that. In this initiative, how will you capture the experiences of these workers, particularly women, both at the economy level and in the specific sectors, and what actors need to be engaged in order to build the resilience of workers in the informal economy and to ensure an inclusive recovery also for them?
Thank you very much, Julian, for the question. And I think that there's no doubt that the Cambodian economy is still composed, largely with the informal sectors. No, many people are working in the sectors, and I think many people come to agree that they are vulnerable because basically, not because the government doesn't want to help them, but basically we have very limited information about what they're doing and where they are, and it's really difficult to actually target them. And under this project, what we can actually answer that is we are trying to ensure that we take the informal groups into considerations. From the macro point of view, I think from a data perspective, it's kind of like hard for us, in terms of data availability and identify those groups. And I think Tang talked about the rich data set in Vietnam that can actually capture from a macro point of view. But in Cambodia, I think we still have a bit of kind of like limitations on data availability from the macro side. But we complement that by trying to collect our data, our micro level data. Now in Cambodia, we focus on agriculture and manufacturing we focus on garment and textile. I know that there are other key players who are working in the garment and textiles to try to understand the impact and also try to understand the recovery process. But I think there are still gaps to fill, and this is what we are proposed to do that. So garments, we tried under garment and textile in our initiative, we are trying to look at the ecosystem of that. So not only the garment, the employees in the garment and textile, but also looking at some supporting industry too, like street vendors who support employee in the garment and textiles, and also subcontractor to factories. And we basically aim to look at women's in particular to try to understand their key challenges and how we can incorporate them into the recovery process. So again, we are trying to provide microeconomic data given the limitation at the macro level. But on that note, we intend to address that concern, and that is why we include them not only in our as a target population in our research, but also along the research process. They will be our respondents in our key informant interview as well, and they will also be taking part in the dissemination too. In addition to that, because we also look at agriculture. Now, agriculture in Cambodia probably, and many agree that agriculture is relatively, not really impacted by the pandemic because we have domestic supply in order to fulfill. But I think that the projected growth of the output in this sector is still slow, providing other factors, one of which is climate change. So with that note, we also try to understand how smallholder farmers, particularly women, deal with this and how the recovery will look like in that particular sector. And I think that there is a policy relevance and policy demands on trying to understand more structural issues in the sector particularly with this pandemic too. So that's what I can tell from this size.
Great, thanks very much. We really don't have much time left, but I want to just give an opportunity quickly to Zau, Pupet, and Tang to comment a little bit more on the sectoral focus that they're also taking, because now Vathana's had a chance to do that in relation to the informal economy a bit more, but nonetheless, if we can hear from the others just a little bit about the rationale for the choice, maybe what's happened in these sectors over the last few months a little bit, and how you hope to have an influence in the recovery process, how you hope to coordinate and engage with other partners who are important in the government and beyond, or some key information about that approach I think would be helpful and answer some of the questions coming in as well. I think we can start with Zau again.
Thank you, Gillian. In terms of sectors, we also follow, what Cambodia and Laos are doing with the, we chose two. The one is the garment, and then the other is the agriculture. In the garment sector, it's one of the most affected sector in the economy, not just from the earlier supply chain disruptions by the COVID in China, and also the low demand from Europe and North America, but lately we also suffer from our own government's lockdowns. We have the first lockdown in April, and then also the second lockdown, which is quite longer, starting from September until November. And then we are still under lockdown right now. So it's already 3 months now. Then I think the garment sector also employ 80 to 90% of the workers are female, poor migrant workers, and they lost most of the jobs. So the job losses in the garment sector represent about 1/3 of the job losses for the entire SMEs. And so they are quite impactful. But the good news is that the garment sector also tend to be the best complying with the labor standards. So then I think that most of these female workers also receive social insurances from the employers, from the government. But nonetheless, there are many gaps, especially those women who are working in the food processing sector, which is another sector we are looking at under the agriculture. They don't seem to have a good social protection schemes, and then they are suffering quite a bit. The other sector that we are focusing on is the agriculture. As you know, agriculture remains the main source of income for the 70% of the rural population. So its impact on agriculture is not only worrying, but also quite an urgent issue for the government, because agriculture seems to be the only hope for the economy to recover in the short run. But now that our agriculture is so much affected, not just by the COVID and supply chains, but also, because of our pandemic situations, all our neighbors, which we rely for trading and exporting our agriculture products, like China and Thailand, they completely seal off their borders, and then we cannot sell them as before. So it's really affected our supply chains, and then also affected our farmers' income at the farm gate prices. So because of that, we are also trying to look at all these effects and then try to inform the government how to deal with our neighboring economies. And then this is where what Jay has mentioned about the regional collaboration, not to seal off the borders, but try to work out something which is good for everyone to get out of this crisis. So in this sense, our research project is going to be very critical to provide the evidence-based policy inputs to the government.
Wonderful, thank you for that. And Pupet, do you want to give some more insight into the sectoral approach that you're going to use as well, and maybe some of the gendered implications of that, or a bit more information there?
Thank you.
Thanks.
About the sector we are choosing is agriculture and tourism sector that During the COVID, it seemed that agriculture sector seemed to be gaining from the COVID pandemic. They earn, as we cross the border with Thailand and another country, it seemed that domestic agricultural product increasing significantly. In the opposite, the tourism sector might be suffering a lot. And that's kind, but we in two sectors, it is also very sad, a common thing because mostly belong to that sector is from the women, especially in agriculture, for especially the poor people in agriculture. But for tourism sector, it is also the some also the poor and women still working there in this sector too. So we want to see how in the future, after the COVID, how we can promote agriculture as the engine of the growth and tourism as well, because we have thinking about the new strategy of the tourism development, because now we have very high potential on eco-tourism, high-end tourism, something like that, that need to rethinking about the policy on this, so that the result. So that's why we choose the two sector. And agriculture also very good buffer for the crisis and COVID, because the reason why we don't have much negative impact on the Laos, because on the migrant and some worker in rural area, they get back to rural area for the work in agriculture sector, so they can mitigate the negative impact from this crisis. Thank you.
Thanks. That's a really interesting point. We've heard that a little bit about the idea of agriculture in other places as well as a kind of a safety net, in fact, that's been used in this time. Dr. Tang, can you give us a bit more as well on the sectors that you're going to be working in Vietnam, some of the coordination mechanisms you'll be using to ensure it's sort of the response is gender sensitive and so on?
Okay, so I think together with gender, very tight sectoral focus is one of the biggest value added of this project in the case of Vietnam, because as I mentioned earlier, in Vietnam there are quite a lot of players, but I don't see any project or any studies in Vietnam that actually look into garments as the two sectors we choose, such as the textile and garment, in manufacturing and tourism and hospitality industry into services. So there is also issues, I mean, of great policy concern. In the case of textile and garment, I think that we can have kind of achieve kind of synergy with the three participating, other two participating institutes from Cambodia and Myanmar, right? Because they also look at the same sectors, so we can have kind of share experiences for, how to say, the domestic policy making processes and also for international community. And in the case of tourism and hospitality industry, we have this similar, I mean, the same sector with the Laos, right? So basically, it's quite interesting to do to have some kind of cross-country comparison, right? And in terms of gender, the textile and garment sector, I mean, in terms of employment, textile and garment sector employ roughly 3 million workers, or roughly 6% of the total workforce in Vietnam. And according to our preliminary analysis of the data set of the labor force survey, in quarter two of this year, as Jay mentioned, that was a quarter when the pandemic affected the economies in the regions the most. Real income of labor workers in the textile and garment dropped by roughly 9%, as opposed to 6.5%, the median value of drop in real income for the whole economy. So basically, quite a bigger, much bigger, quite bigger gap, bigger impacts on the economy as a whole. For textile and garment, roughly 70%, Kyoko mentioned in her presentations, roughly 70% of workers are female, right? So it's basically very good for, how can I say, gender-focused analysis. The tourism and hospitality industry, the hospitality industry was hit the hardest in the second quarter. So real income of workers in this sector dropped by 25% as compared to the same quarter last year. So the largest drop in real income of this sector in the economy. In the tourism sector, the real income dropped by 20%. And in the presentation, but we need to think about recovery, or about the policy question is that how to reopen our border in order to help, how can I say, the tourism and hospitality industry, which are in a very bad shape at the moment. So I think that in Vietnam, domestic tourism recovered very well because we have roughly 100 million people population, and roughly 15 to 16% are middle class, and another 60% are classified as economically secure group, so they can have money to spend. So that's why, we hope that the sector started this process of recovery. But I think to fully recover, tourism and the hospitality industry really need to kind of reopen the borders. So I think that by monitoring this sector, we can address a number of issues. One is about, impact on gender equality, another on employment, and the third one is, a reopening strategy, right? Reopening the border. So there are a number of quite key policy concerns that we can address here with our, how can I say, research. And I mentioned earlier that we actually try to make to generate the largest value added by looking into things that are overlooked by, or not looked yet by, other organizations, that is the non-income, non-employment dimensions of gender equality. So I think that is one of the things that we try to do over the next few years, couple of years. Thank you.
Great, thank you very much. I think, unfortunately, we do need to wrap up. I think we're a bit over time already, but this has been a really great discussion, and we've received a lot of questions online that have been excellent that we didn't get to go through in depth. I hope that some of this has answered them as we've discussed the different approaches in the different countries, but I think that we can sort of do a little bit of thinking maybe after on how we can reflect on some of the comments and the questions we've received and try to address them in a different way. And this is, of course, the first in a series of webinars, so hopefully there's a lot more opportunities to share and to learn in the future. So I'm really pleased to see this initiative getting kicked off. We really do need good data, good evidence to ensure a strong recovery from the pandemic, and this team in the Mekong will have a really big role to play in collecting that data and providing that information. And guiding this process a little bit, ensuring that actors are involved along the way. So thanks again to all of the panelists, all of the participants, and of course to CDRI for organizing this exchange. And I'm going to hand it back to Vithana, I believe, to sort of guide us out.
Okay, thank you very much, Julian, for moderating the session, and also thank you, panelists. Thank you, Zau, Tangs, and Popet, for joining this discussion. And again, as Jillian mentioned, this is our first sessions of this webinar series. We will be doing more, especially when we have our first rapid assessments of the situations. So there will be other sessions that we will be organizing, and hope that our participants will continue to join us to update, to get the updates, and all to share and discuss on the issues further. Without holding you back further, first on behalf of the CDI's Executive Director and Management, I would like to thank once again IDRC for supporting this initiative to make it happen. and also participating institutes in Laos, in Myanmar and Vietnam for taking this. We will be working with each other moving forward. Also thank the two speakers, Jay and Gyoko, who are also technical advisors to this project too. And last but not least, all participants are in today's events. Again, this is the first one. There will be a few more to come. And I hope that all of you will still be engaged in the discussions, which provide evidence and also kind of ideas for policy makings and other key actors for a resilient recovery. So on that note, once again, I would like to thank all of you. Have a nice day, and we will keep you posted moving forward. Thank you, everyone.
Thank you.
Thank you very much.
Thank you.
Thank you.